Thanks everyone for joining. My name is Dr. Chad Achenbach. I am the Associate Director of the Robert J. Havey, M.D. Institute for Global Health. I'm also an Associate Professor of Medicine, Infectious Diseases, and Preventive Medicine here at Northwestern's Feinberg School of Medicine. Thanks for taking the time to join us this afternoon. This is our latest installment of the Havey Institute for Global Health's IGH seminar series, and this one's entitled Evidence to Policy, Obstacles and Opportunities. So we have Dr. Karlan today, who is going to be presenting, and I'll do a brief introduction and then have some comments. But today's session is meant to be very interactive and have a lively discussion with a kind of a unique speaker who's here at Northwestern as well. But if you can, please take a moment to follow us on Facebook, as well as Twitter or Instagram. Our handle on all those is @FSM Global Health. In addition to that, if you would like to become an Institute member to receive access to specialized resources and services, we also have support for research infrastructure that's global health related. So for more information on that, you can visit our website, which is globalhealth.northwestern.edu/members. So today we are thrilled to host Dr. Dean Karlan for our special seminar event. So Dr. Karlan is the Frederic Esser Nemmers Distinguished Professor of Economics and Finance and co-director of the Global Poverty Research Lab here at Northwestern. So we were just discussing something. He's really splits his time between here at Northwestern and also at USAID. So since November 2022, Dr. Karlan is the Chief Economist of the United States Agency for International Development, or USAID, that provides a lot of funding and resources for global health type work and projects. So his research, though, focuses on development and behavioral economics, typically using experimental methods to examine questions about poverty and behavior modification. Previously, he was professor at both Yale and Princeton universities. He is the founder of Innovations for Poverty Action, co-founder of StickK.com, co-founder of ImpactMatters, and a board member of the M.I.T. Jameel Poverty Action Lab. So he's co-authored several books entitled More Than Good Intentions, Economics, Failing in the Field, and the Goldilocks Challenge. For his training, he received a Ph.D. in economics from M.I.T. and M.B.A. and M.P.P. from the University of Chicago here on the South Side, so Chicago guy for a long time now, and also a B.A. in international affairs from the University of Virginia. So there's going to be plenty of time for discussion and questions during this event. It's really pretty interactive. I'm going to hand it over to Dr. Karlan. He's going to do some introductory comments for a bit, and then we can open it up to discussion and asking him some questions about the type of work that he does, what's going on at USAID, all those different things. So we welcome you, though, to submit questions through the Q&A feature at the bottom right hand corner of the screen throughout the presentation or when we get to that section. But for now, Dr. Karlan, I'll kind of turn it over to you for some introductory comments. Welcome. We're really happy to have you.
Great. Hi, everybody, and thanks, Chad, and thanks very much for inviting me to come and talk with everybody and meet everybody. I'm very excited about the particularly the format of more of a Q&A, because there's a lot of exciting work that I know is getting done, and would love to hear more about it, particularly as it relates to the Global Poverty Research Lab and looking for areas of potential collaboration. So I am, just two clarifications I just want to make kind of clear. I've learned to be a little bit of a dorky bureaucrat in a couple of ways. One is to make it clear that I am here speaking as a professor at Northwestern. I'm not speaking in anything I say as as my role of Chief Economist of USAID. Happy to talk about broadly the challenge. In fact, most of what I was going to prepare and what I prepared as kind of some opening thoughts here are, what are the challenges of getting things into policy? And of course, that applies to by things, I mean evidence-based ideas and evidence-based programs and policies. And obviously that applies to large donors, but it also applies beyond merely example of USAID. So the comments I'll make are not particular to anything internal to USAID, but they are obviously things that have been informed by my experience there. The main thing that I was excited to there's two areas that I was excited to share with you, and but I was going to use the second as really just an example as I talk through a little bit opening comments on the first, which is what do we need to know more about for the evidence to policy process? What are the hindrances for seeing evidence get into policy, and are the evidences are the hindrances on the evidence side? Is it on us researchers that we're not translating things, we're not doing the work that needs to be done to make it more usable, more applicable, more widespread in the sense of where it would be appropriate to scale? Is it more on the, are there other issues on the policy side that are various obstacles? I want to talk through that. And one of the areas that we're very excited about at the Global Poverty Research Lab is mental health. And I see this very much, the research that we're trying to, that we're embarking on, that we have started and we're trying to grow, is quite focused on both, first stage research about the way that mental health inhibits the ability of individuals to seize opportunities. In many cases, we are talking about economic opportunities. We are economists, but we do think about lots of things that are not about dollars and cents. So we just mean about the way mental health gets in the way of the ability to engage in community activities and social activities as well as economics. And so part of that is evaluative, about looking at the evaluation of various efforts to alleviate some of those issues, about the way it intersects with other policies, economic policies that might be interplaying, and does combining mental health with other economic-based interventions lead to even bigger impacts or not? But part of the work there that I'm very excited about is making sure that that's not just set up as research projects, but these are integrated in so that we are kind of having a faster on-ramp to policy impact in the way the research is done. And I think there's some important differences about some of the scale ambition that we would like to be able to achieve. These are ambitions, not things that I can say we're actually doing at the very moment. Broadly, I wanted to kind of say two broad things about the evidence-based policy space that help at least share with you, at least get a sense on how I think about the world in some sense. The first is, I think, there's a lot that when I first started working in this area, I was familiar with the term evidence-based medicine, which always struck me as a little bit of a funny term, because I kind of was a little bit struck by, like, well, what other type of medicine is there? I was a little, confused why, I realize I'm speaking to people who might be able to rattle off a million reasons why it's controversial. But I remember when I first heard this, was being a little bit struck that that's like an adjective that you would ever want to attach to the word medicine, where it's not just built in and part of medicine. But evidence-based policy, there's some really, as I see it, some important differences that make the space harder and a little bit more onerous for us researchers. One is just a lot more within site heterogeneity that we don't fully understand. That is, things are much less mechanical. It's not pills and biology and replicable things in labs. Not to say everything in medicine is replicable in a lab, but closer to that side of the spectrum than a lot of things in social policy. And there's also just a lot more heterogeneity across site that's going to be driven by everything from the economic conditions to the implementer of a policy to local politics. The objectives are also less clear. It's not you're not contained to mortality, morbidity data and outcomes, but it's might be poverty, and then how do you measure poverty, and what's the timing in which to measure? And obviously, with health measures, there's some of these same complications too, but the sense I have, at least from the times I've been engaged in one or the other, is that there's a lot more objections that are raised in the evidence-based policy based on these kinds of dimensions. And then there's politics on how do you aggregate up preferences, basically, of people in the communities. And so when I think about this, at least I've tried to think about this in three levels. And we did start a evidence to policy research initiative at the Global Poverty Research Lab. We're still active and still doing it, but it is the case with my with taking on the duties at USAID that I took on we have not been quite as active for the past year as I had hoped. But we are doing some really important work on one of the issues that I'll mention in a second. So when we thought about trying to set up more research on this process, we basically divided our thinking into three groups. There's policy problems, there's practice problems, and then there's just a more general problem of individual behavior taking up evidence. And that applies to things beyond policy. It applies to how we live our daily life. So when we think about policy, we think about things like distributional special interests, where sure, it might be the optimal policy based on some analysis which treats everybody equally, but that's not the world we live in, and there's special interests which have extra power. Sometimes that's maybe something that we would think of as a human right. Sometimes it's actually, comes from money and comes from, power in a way that, doesn't really adhere to the way any philosopher would actually, rightfully argue the world hopefully should be organized. It could be human capital policymakers. There's been a lot of interest in, I've seen work at the World Bank, for instance, focusing on this issue about how do you just communicate the results in ways like bar charts versus tables and things of this nature, and how do you communicate evidence in a way that helps policymakers quickly digest it when, a lot of people can be really smart people who have their expertise and but they don't read, they don't read regression results, and that's not their way of thinking about the world. There's a term I heard the other day called rejectionists, which I think is a cute term for the kind of the thinking that says, in a sense, nothing has generalizability. Like, okay, great, you can show me research that says this worked over there and maybe 7 other times, but over here it's different. And sometimes that's true. Sometimes it is different where we are. Personally, I find that objection is always, what I always try to do when faced with that kind of conversation is to try to isolate, well, what's different about it? And, I've been in situations, for instance, where the named thing is like, well, what's different here is there's no water. It's a more water scarce environment in this part of the world. And so this program that was being done somewhere else won't work over here because we first have to build better water structures. And that may be right in some cases. In the case I experienced, we were able to get data about water access in the places where a program had been tested, and it turns out that it had been tested in some really water scarce places, and that was not a necessary condition to make the program work. It's not to say that fixing water might not have been good, but it was not needed to make the program work. And so the kind of this objection that says it's always different here, and here's it basically, in my view, is actually a really useful and healthy question to ask, but needs to be followed up by then thinking through, well, what are the features and the contextual factors that make that different where you are, where you're thinking about trying to implement policy, and then push oneself a little bit and say, okay, well, is it different, and how much different should this matter? And maybe we can learn something from some of the other places where something has been tested to help us learn whether that issue is going to be likely prevalent or not. And if it really is truly unique, that's a window to say, great, well, then maybe we should do more research in that kind of context to find out the answer there. One thing which I only recently learned, and I think I actually find myself quite naive to admit that, but it's true. It's just a matter of being busy and overworked. It's like one more thing. It takes a lot, policymakers who are trying to implement policy have lots of special interest in various groups saying, do this, do that. Yeah, they're trying to solve a problem. They have 17 things that are thrown at them as ways of doing it. They might be in a situation in which they've been doing it a certain way for a while. That's what everybody else is doing around them. And meanwhile, they have 17 things they have to do in order to get this done that have nothing to do with evidence, that have to do with procurement, that have to do with various administrative rules and laws and ethics. And that keeps them busy, and they're got a full plate, and they're not going home early, and they're not shirking on the job. And when someone says, hey, you really ought to choose evidence-based programs, they say, well, that's great, but with what time of the day am I going to do the analysis I need to find out? Whereas if I just do the same thing that was done last year, like no one's going to actually fault me for that. Like I'm in safe zone because that's what everybody's doing. So the too busy and overworked is a real issue. And I had presented on thoughts like this before, and that was not in the bullets. And when I was reflecting on talks on what I wanted to open and share with today, that was added. But I think there's also a lot that's on us as researchers. That's on the research quality, on the transportability, on our often reluctance as researchers to do replication, on needing to share data, make it more public, on more consistent measurement, on setting up more mega studies and multi-site studies that and doing more meta-analysis. This is not, at least in economics, I would say, it's not done that much. And then lastly, also doing more operational research, because a lot of times the idea might have genuine transportability and generalizability, but the way it gets implemented in a particular place needs to be modified. And yet knowing how to do that is not often as rewarded as the idea, the big idea, at least in social science. And so these all fit into these are, kind of the set of things that I think are the, kind of the common obstacles that I would call on the policy side. Like I said, some of those are because of the system of policymaking, and some of them are insufficiencies in the research. There are some very practical issues as well that are about bureaucratic obstacles, about multiple objectives, where, as researchers, we might have a solution to a specific problem, but in the policy can't just only design around that one problem. It has to design around 4 problems at the same time. And so that kind of multiple objectives problem is a very practical issue that gets in the way and makes it hard to just insert one idea at a time, which is kind of the way academics at least usually operate, and having more granular laser-like research that says, oh, here's a good idea and to do, but if it doesn't fit into a larger policy that is doing many things at once, it doesn't fit. The third category I want to skip, we can talk about it if you want, but if someone asks, but I do think a lot of the questions that we're asking in this space actually apply to daily life too. So I find it, the general question of like, why don't we do things that have strong evidence we can apply to our own life about how we eat, how we exercise, how we vote, things like this, how we give to charity. So the last thing I wanted to share is what we're doing at Global Poverty Research Lab. So at the Global Poverty Research Lab, which is based up in Evanston, we're administered under Kellogg, but we aim to work across campus. So we'd be totally thrilled if there's any potential collaboration with faculty or grad students in public health. We definitely are very keen and eager to hear what people are doing, and if there's rooms for us to be able to help in some way, whether it's via collaboration or some other type of support. One overriding theme of GPERL is that we are, it's mostly prospective research. We're usually partnered up with and doing some form of data collection, usually under the umbrella of a randomized controlled trial, not always, but usually. We have what we think of as what we call the cluster approach. We have 2 clusters that with large panel data that we've been collecting. One that we've been collecting, one we're about to. The Ghana we have been collecting for over 10 years now, and in the Philippines we're about to start. We also have a cluster in China that doesn't have a panel data associated with it, but is just a cluster of research and activity. The other approach, though, to clusters that I wanted to share with everybody here is on sector. And so this is what we have one that we're working on with social protection and another on financial inclusion. But the one that we're really excited to start is on mental health. And this hits on what I mentioned earlier. We have already done some work on cognitive behavioral therapy in Ghana, on a psychosocial intervention in Niger that worked, that had some really impressive positive impacts on economic outcomes for households in Niger. We have some results in Uganda that actually went negative, some positive, but some actual negative, where depending on how the therapy was rolled out, it actually led people who were depressed to become more depressed. So it was not obviously what the program was aiming to accomplish, but some potentially very important lessons from that. But We're also starting some new work on chatbots with cognitive behavioral therapy. And the thing I want to emphasize here is that we're trying very hard not to just be a collection of projects. We want to form a team of like-minded researchers who want to do multi-site studies, who want to make sure that the measurements and conversations are helping to coordinate. Ideally, we do some collaborative fundraising to really have a center that can lead to a plethora of research so that we can get out from this kind of one intervention. Here's my randomized trial. Look at this treatment effect. This works, but yet doesn't actually tie the link right to policy in a comprehensive enough way to make that on-ramp smooth to actually seeing policy move. And given the advent of things like chatbots and in developing countries, some other ways of running like community cognitive behavioral therapy, like we did in Ghana, that was done with just recent college graduates. There's a lot of venues now that we're seeing for scaling up interventions on the mental health side that are fairly exciting, but need a lot more evidence. So we're really at the infancy of trying to build this. And so with that, I will stop. I talked longer than I was hoping to there, but hope that was helpful for getting a flavor for what we're trying to do. And let's go to chat.
Yeah, well, thanks for the intro and telling us a little bit about yourself and everything going on. And so I think now we can kind of open it up to some discussion. I think we don't have anything specific in the Q&A yet, but if anyone has anything they want to throw in there, I think people do have the ability, if they want to unmute themselves and talk as well. I think, right, Meg? I think if participants would like to do that. But I can get things started. I think, I do think there's a lot of overlap potentially, with the global poverty research lab. And you mentioned mental health as one kind of health area where you're thinking about interventions and maybe some health outcomes that might be related to poverty. Other health areas that you guys have been thinking of, or that you want to tackle, or you want to see how they're related to poverty? We have 9 centers actually within our institute and cover a lot of different kind of health related areas. So I guess other specific health related areas related to heart disease, cancer, infectious disease. We have a lot. Pretty much poverty pretty much impacts all of those things, all of health. So I guess are there other areas you envision maybe having more collaboration where us and within global and public health could help collaborate?
Sure. So broadly speaking, well, so first of all, the panel surveys that we're like about to roll out in the Philippines, I don't have the health section memorized, but it does. We do ask questions about other facets of physical health. There is a lot of work we have done on food securities, and mainly because that's and then the stunting and wasting that can accompany that. That's mainly done under the umbrella of the social protection work we do when we're working on social policies to help build income for ultra poor households, and then we're looking at food security as an outcome. Some of that intervention could be described as a kind of directly on food security. It might include some food supplements, but I wouldn't call it a nutrition intervention per se. It's just a really important outcome that everyone's very focused in on. Actually, some of that work is funded too by a USAID group that is quite focused on nutrition as an outcome. The other thing I would say more broadly is I think at least our focus, but we're not we're if there's an overlay of someone who wanted to do research that was overlaid with our panel in some way that was strictly a health question, then we'd be totally open to hearing what the ideas are and seeing if we can help. If it's a right setting to help answer the questions they pursue. Most of the times when we're doing health work, it's on the behavior change side of health. It's on adherence. It's on vaccine hesitancy, for instance. I've done work on misinformation there. We've done stuff in the past. We're doing new things. So it's usually on the behavior side, on adoption. It's on community health workers and understanding what are the various options for how to organize and implement community health worker programs, and then what does that imply? We've done work on pricing of health products. So we tend to work on either behavioral or the service side of health to understand what service structures are working and what incentive processes are working better than others to get people the right health services.
Yeah, that makes a lot of sense. I mean, I think, and there, within the medical social sciences downtown here too, within Feinberg, there's some expertise in, kind of behavioral health interventions as well. So it seems like there's a lot of opportunity for our campuses to talk more. There was one question in the chat here, and I think we've actually changed everyone's status so people can just come off mute and chime in if they'd like to ask questions as well. But I'll jump to one that Dr. Jaylene Jordan has. She asked, as a researcher from the US, how do you think about your role in influencing policy in countries that are low resourced or lower resourced and less globally powerful?
Right. I think, I mean, it's the reason why I do what I do, frankly, in terms of, my philosophy. I try to be utilitarian in my own kind of way of thinking about the world. And, I started my work I started my interest actually before I got into economics. I was far more interested in human rights and civil liberties. And I do fundamentally see economic rights as a core, as a right in that sense. And the fact is, there's people in lower resourced, less globally powerful countries are the ones that don't have access to the same resources by definition. And so the reason I work where I work is just a feeling of ethics of the vast inequality and injustice in this world. And so if I have a choice I think about it as cost effectiveness of my own work, my own time. Think about it that way. If I can, and I would say the same thing to a donor. If a donor ever says to me, where should I send my money? I can help a program in Cleveland or I can help a program in Chad. I'm like, well, you can help probably 20 people in Chad for the same amount of money. You can help one person in Cleveland. To me, that's an unambiguous decision. So I see this question as just an ethics question on why would you not work and try to do the most you can to wrong injustices where they are deepest.
Right. And I guess I'm guessing that influenced your getting involved with USAID and that group. So we do have a couple other questions, but I actually have another question about how did you get involved?
Oh, yeah. Sorry, go on.
Oh, I was just saying,
I'll answer that.
How did you get involved with USAID? I think there's a little bit of, not always, but a little bit disconnect between the kind of academic world, academic institutions, and then the government world and like a USAID. And there's been funding opportunities we've looked at from time to time. But I guess how does Northwestern or someone in an academic environment like IGH, like our institute, kind of make inroads, kind of working with USAID or receiving funding from USAID? I guess do you have any advice for us on how we would approach that?
I don't know how to advise on getting funding. That's not other than kind of the obvious
application,
apply and things like this. But I mean, I got involved. In development economics, we've now seen about 5,000 randomized controlled trials in the past 25 years.
Wow,
and I'm proud to say that the organization I founded, Innovations for Poverty Action, and the other one, which I used to be on the board of, actually, the M.I.T. Jameel Poverty Action Lab, we're directly managed or responsible for probably about a third of them. And so, couldn't be more proud of being, part of that movement to help get that going and get that mindset into thinking about how we can do more good with the resources we have to address some of the problems that we all face in this world. And so, for what it's worth, why, there was an effort at USAID about 20 years ago to do more evaluations, to contribute more, to do more randomized trials, and ideally to use some of the evidence more. But back then there weren't as many studies out there, so it was a little bit early for saying let's go form policy around this new wave of evidence that was coming out. But now there's a ton, and so when the administrator Samantha Power became the administrator, she decided that one of the main mandates that she wanted to push forward in her vision for what to change about USAID was, there's a world of evidence now, and let's start using it, and let's start actually contributing more to the global public good of knowledge and doing more, particularly in things in the behavioral science side. And so that was her one of her she had two or three different mandates that were part of her vision for what to transform and try to shift USAID. So it was in that spirit that they reached out to me and asked whether I would help try to move that and lead that effort. So
your academic work just kind of naturally led you in that direction. It sounds like that's great.
Yeah, there's a certain element where if I'd said no, I think I would have been a huge hypocrite, because if you ask me my life story, my life story was kind of like I was working in El Salvador, doing coding on software, working for a micro lender, and I was really struck by how little we knew about what was there because you're working, what was not, and so I took on this this research because I was it's almost, I always found it a little weird. It's like we're professors, and so we're expected to know stuff, and yet as researchers, I chose the profession of a researcher because I felt like I knew very little. And yet people turn to us as like the learned ones, like we're supposed to know stuff, and like, but if we knew stuff, I wouldn't be a researcher. I was supposed to do stuff.
Exactly. We wouldn't have any questions to answer, right?
Yeah, no, exactly. So you gotta be, I think what makes us and
it goes both
good
ways
at our jobs, I like to think, is our willingness to say what we don't know and be open and admit it, and then just set up processes for helping to learn. But the point is, I feel like I would have been a hypocrite if I said no, because I say I got into this because I saw this as a void, and I wanted to, and I felt like it was, I felt like I had a skill set in terms of kind of quant instincts and research sense that I could work in this and help fill that void, and I was excited by that. And so then if someone came to me and said, okay, great, now you can actually work at the agency that is the largest bilateral to help make that happen, and if I said no, I would have had to change my intro to myself, that when someone asked me how to get into this, I would have been a hypocrite. So that's how I.
That's always good to hear, individuals' paths. There was another comment in the Q&A. So
mentioned,
if you want to recap that and the question there.
So it's not so much an ethics issue in the sense that look, there's many things that we study. I mean, look, this is not something that we study. It's not an ethics issue, first of all, because it's not like we were.
I'm not sure everyone saw the comments. Maybe we should recap.
The question was, you mentioned negative results from a therapy initiative in Uganda, which I feel like raises some ethical issues. Could you discuss how the GPRO raises ethical considerations in its research and policy work, especially on the ground, and especially when considering mental health? So the reason I say this is not an ethics, I mean, I guess maybe I should say what the necessary conditions are to not making it. Obviously, if we had thought there was any chance that this could lead to bad results like that, then it would have caused us to take pause and think hard about, and then there's things to think through about what those risks are and how real they are and things of this nature. But a thing to note here is, first of all, one thing that's different about the way economists operate in this kind of space is we're very, very rarely actually doing anything. We are researchers studying, and other people are doing things. And that actually is a really important distinction. There are many economists which study firm behavior specifically because they're think something can go wrong, and yet they're being able to study it, and they're learning, and they're helping to share, and like documenting that it did harm. Is actually really beneficial to society to document that. Obviously, that's not unethical to study firm behaviors that are doing things that are, that are themselves unethical. what, so the first order ethics that is like the absolute, like, obvious issue that we are very, very aware of and skilled up and trained in is how we interact with the people we interact with when we're collecting data, if we are running an intervention, with how we're engaging with people in terms of providing respect and dignity. The thing that I think is, and so, a lot of people hear that and they often think, okay, so you mean you have IRB approval? And it's like, of course we go through IRBs and of course we take those things seriously. But at the same time, I think there's also a over-reliance that people have on IRBs, in thinking of an IRB as an ethical review board rather than a legalistic review board with a series of protocols that you have to follow. The reality is, if there's an ethical violation in how we interact with people, IRBs aren't going to be the arbiters of that, and they're not going to drive that. That's about staff training. That's about surveyor training. It's about teaching and making it, part of the culture of your interaction with households when you're doing a survey, that your surveyors know that they need to exercise their empathy skills. If they see somebody upset, you do not continue that survey. You read their body language, you read their voice, and that's important. You listen to what's going on, and you treat people with respect and dignity. That doesn't come, there's no IRB process for monitoring that. There's no IRB monitoring your staff training to see how well are you doing at this, and are you hiring good people in these dimensions. So there's this weird reliance that we have, and the fact is, it's a scary statement to make, but the fact is, it is a self-policing system. And if you have the right culture, then problems do get up-reported and transgressions get reported, and and you learn and you improve. But that comes from an organization that adheres to that. It's actually, that's part of one of the reasons. There's more. It's more than just that. It was one of the motivating reasons for starting Innovations for Poverty Action, because I'll say it a little more generally than just this ethics issue. But one of the things I was concerned with back in 2002, I just finished grad school, and I saw we were just getting going running randomized trials. Esther Duflo and Abhijit Banerjee and were two of my advisors, and I had helped them get started with their first RCT in India, and then I went off to South Africa, my fourth year grad school, and started my own. And Michael Kramer was setting up experiments in Kenya. There were the three that won the Nobel Prize in 2019 for basically kickstarting this movement within economics. And we were about to rotate the next year to another grad student. I went and helped them, set up, passed it on to another grad student, and here I was setting up some research in Philippines. I got a grad student to help me and go do this, and every 6 months we're going to pass the baton to another grad student. Now, this is a general issue. It's not just about ethics, but that's not a good way of managing fieldwork, managing partners, doing high quality data collection, making sure experimental protocols are properly followed. And that applies to the ethics question about how you treat people, but it also applies to a million other issues. And that was one of the motivations for starting Innovations for Poverty Action, is recognizing that a model in which we just relied on a rotating set of grad students was actually not a good model. You want to get grad students involved. It's good training. It's good. We want to inspire them to be involved in that kind of work. But you also need a team of people who are going to be longer lived than that and working to help execute and manage these kinds of projects.
Yeah, I think you bring up a good point. We always try to emphasize not so much what we're doing, it's how we're doing it, especially in global health. So I think those are some good insights. Any others have any questions or comments or discussion? Feel free to pop something in the Q&A, or you can come off you can unmute yourself and ask if anyone has any other questions. I can open it up to the general group here. I had one other thought that when you were talking a little bit about kind of policymakers and making policy and people with their special interests, and obviously time is an issue where they're busy and have a lot of things to do, and we just I think that it happens in just in general in medicine as well, where we just kind of do the status quo, what people have done before us. And so we're always thinking about how to inspire kind of innovation. So I guess, what are your thoughts about inspiring innovation more in policy, on the policy side of things? What can we do to like overcome that stagnation and kind of try to inspire policy in new and different ways?
So, so one of the slogans that that I think captures behavioral economics fairly well is or I should say, applied behavioral economics, the world of nudges that are using insights from behavioral economics to try to alter policy. Like when said in a non-jargony way, I think a fair summary is that is a world which is trying to make it easy for people to make the decision that they would say themselves they want in a moment of deep reflection and perfect information, which is not a moment that most people ever experience, but like that is the goal, is to make it easy for people to do that. And that's basically, I think, one of the, I mean, it's not the only thing to do, and there's other issues obviously to face, but I think there's a lot of context where that is potentially the issue. That's the right way to tackle, like, like what you described as when you refer to the overworked and overburdened. And so there, some of that is on us as researchers. We can't just email them the paper from whatever, even if it's Nature. Like, you can just email the Nature article and think that, okay, great, I sent you the Nature article, can't you just go do that now? But some of it is also, it's not just a matter of writing up, a layman version of a technical article. It's about doing the meta-analysis. It's about helping to understand, okay, even once you've done the meta-analysis, how do you still know how to adapt this to a new place? So I'll give you an example of one from education, which is, there's a program called Teaching at the Right Level, which is a program which has now been tested in maybe a dozen locations with randomized trials. I'm not aware of a single instance where it didn't work. I could be wrong, maybe there's one, but I'm not aware of them. Different levels of how it worked though. And the kind of participation rates turned out to drive the efficacy a lot of the program. So that tells you a lot about implementation, and the quality of the implementation was a big driver. But if you want to go to a new place and you say, hey, look at this evidence, we show you 14 different randomized trials, all showing you positive results, here, go do this. That's not going to work. They can't just pick up those 14 papers and say, great, now I know how to do it. And there are some differences that you need to pay attention to. For instance, what is the voice of the teachers union, and what is their opinion of this program going to be? And that varies across places, and that has implications for how you're going to actually implement the program. Are you going to implement it in lieu of a class, after school? Are you going to use the teachers or use non-teachers? Who is going to actually be the employee to go and implement this program? These are basic operational questions. You can make the program work either way. But in a given location, you need to know something about the teachers' unions and the issues that they're facing, and the struggle between them and the schools, and how much they're paid, and things of this nature, in order to be able to make a good, strong operating plan for how to implement this policy. And so that's an example of, if you don't make it easy for the policymaker to have answers to those things and know what to do, it just becomes a glossy meta-analysis with the most amazing bar charts and graphs, and everything looks pretty, but it's still going to be you're not taking it over the finish line to help iron out some of the really important details for, like, what do you actually do to implement this? What are the contextual factors you need to know to lead to modifications to the program? What are the choices? How do you make those decisions? But that can be done. That kind of make it easy. And that is something that we're focused on in a few different contexts, is really thinking through that final step of that analysis.
Excellent. Yeah, I think it's a tough question, but yeah, I think sounds like you guys have thought a lot about this. Something we're always challenging ourselves with, how to move things to the next level. All right. Any other comments or questions anyone has from the group? anything else? Well, thanks so much, Dean. This has
Okay.
been great. It's been great to connect with you.
Yeah,
You know, and across campuses here, we don't get this opportunity too often. So good to hear a little bit about what is going on there in Evanston with your group and the Global Poverty Lab. Really interesting work. It sounds like there's a lot of opportunity potential for, you know, collaborations with both our kind of public and global health programs here downtown. So thanks again for joining us.
yeah.
It was really great. And thanks to the
Thank you,
audience
everybody.
for joining in and, you know, some of the thoughtful questions from the group.
Great. Thank you,
Um,
everybody. And please do reach out if anybody wants to talk about and thinks there's rooms for collaboration or rooms where we could provide some help to something you're trying to do overseas. Thank you very much, everybody.
Thanks. One last note, we invite everyone next month for our special event. We have our annual Global Health Day. So this is going to be an in-person event on Friday, December 1st. It's always a great event, our Global Health Day. And this year we're very excited to feature a keynote speaker, Dr. Carlos Del Rio. He is the Leon L. Haley Jr., M.D., Distinguished Professor of Medicine, and he's the interim dean at Emory University School of Medicine. He's also a professor of epidemiology and global health at the Rollins School of Public Health at Emory. And many of us know Dr. Del Rio quite well from his work in HIV, and he's going to be presenting on December 1st on lessons from the HIV epidemic that are applicable to future pandemics. And I don't know if you guys saw him, but he was in the news a lot, kind of like our very own Rob Murphy. He was on TV a lot during the COVID pandemic and giving his infectious disease perspective. So a real leader in our field of global health and particularly global HIV. So this event will be in person in the Lurie Medical Research Center. You can register via the little QR code there on the screen. Also through our newsletter or social media, you should be able to find links to registering. Please register for this event if you can. And anyone interested in submitting an abstract, it's not too late. We are going to have a Global Health Day poster session, and we have extended our abstract deadline now until Tuesday, December 7th. So you have almost a full week more to get your abstracts in. Please send those in to us so we can have a good representation of all the different work going on globally within our institute and even across the university. So I encourage all of you to submit an abstract about your work. So again, thank you everyone for joining us today. There may be a recording of the webinar that's available online, and we will conclude today's webinar. Thanks everyone for joining. We appreciate seeing you, and we'll see everyone on Global Health Day, December 1st.